Welcome back to the deep dive. If you share your home with a female dog or cat who hasn't been spayed, well, today's deep dive is incredibly important.
It really is.
We're tackling a serious, potentially life-threatening condition called pyometra.
Yeah, it's genuinely one of the most common and urgent reproductive emergencies vets see. So understanding it is key for any owner.
Absolutely. So our mission today really is to cut through the complexity of the sources we've looked at, veterinary texts, research papers, clinical notes, all sorts. And the goal is to give you the most crucial nuggets of knowledge about what pyometra is, exactly why it happens.
Yeah, the why is important.
How it's typically diagnosed, and critically, what can be done about it.
Yeah.
We want to give you that core understanding you need to be well informed.
Okay, let's get into it.
Okay, let's unpack this. At its most basic level, what is pyometra?
Think of it this way. It's a severe infection inside the uterus. It causes the uterus to fill up with pus.
Pus.
Yeah. And this happens in female dogs and cats who still have their ovaries. I mean, the medical term talks about inflammation of the lining, but the really scary visual is that pus buildup.
Pus in the uterus. Yeah, that immediately sounds like a major problem.
It is.
Now, the sources spend a good amount of time on why this happens, and it seems a bit complex, multiple factors involved.
It is complex, definitely not fully understood.
But is there like one central idea that explains it, or one main cause?
Yes. There's one absolute non-negotiable requirement for pyometra to happen,
Okay.
and that's the presence of progesterone.
Progesterone, the hormone we associate with pregnancy.
Exactly that one.
Yeah.
So in female dogs and cats who cycle normally, their uterus is exposed to high estrogen during their heat, or estrus.
Right.
And that's followed by about 2 months of prolonged high progesterone if they don't get pregnant.
So even without pregnancy, that progesterone is still high for a while.
It hangs around, yeah, for about 2 months during that phase called diestrus.
And that extended progesterone exposure, that's the issue.
That's the setup for the problem, absolutely. Progesterone causes specific changes in the uterine lining. The courses call it cystic endometrial hyperplasia, or CEH.
CEH, okay. What does that mean, practically?
Basically, the lining gets thickened. It gets these little cysts. You can imagine the lining becoming unhealthy, sort of bumpy and irregular. It's not a healthy environment.
Okay, so progesterone makes the lining unhealthy, and that's where bacteria come in. Is that the next step?
Precisely. Bacteria, often E. coli types that are normally found in the vagina, they can travel up into the uterus.
When does that happen?
Often happens during the heat cycle itself, proestrus or estrus, when the cervix is partially open.
So the door is open, basically.
Kind of, yeah. The door's open, the bacteria go inside, and progesterone has created this welcoming but unhealthy environment for them.
And progesterone does other things, too.
It does. It also suppresses the uterus's normal ability to contract and clear things out.
Oh.
And it stimulates secretions that are basically food, excellent growth media, for bacteria. So it's often the CEH, the unhealthy lining from the hormones, and a bacterial infection sort of happening together.
So the bacteria might even help cause the CEH.
That's suggested too, yeah. They can act as irritants under progesterone's influence. But the sources are really clear. Pyometra never occurs without progesterone being involved somehow, either produced naturally or given as medication.
Wow. Okay, so progesterone is truly the root cause here, setting the whole stage. That makes a lot of sense.
It really does explain why intact females are the ones at risk.
Right. So who gets it? Who's most likely?
Well, both dogs and cats. But again, only females who still have their ovaries.
And age, is it older animals?
Usually, yes.
Yep.
Typically middle-aged to older, often over 6 years. But the age range in the sources is actually really wide.
How wide?
Dogs as young as 4 months, apparently, but to 16 years. Cats are similar.
4 months. Wow.
Yeah. Though if an animal has been given hormonal medications like estrogens or progestogens, they can definitely develop it much younger.
Okay.
And there's also something called stump pyometra.
Stump pyometra? What's that?
It's rarer, but it can happen after spaying if a tiny piece of ovarian tissue was accidentally left behind. That little piece can still produce progesterone and cause infection in the remaining uterine stump.
I see. So spaying usually prevents it unless there's that rare complication.
Exactly. Spaying is the best prevention.
Are there certain breeds that seem more prone? You hear things sometimes.
Well, the sources do suggest a possible genetic link in some related family lines.
Okay.
And specific breeds are mentioned, like Bernese mountain dogs, Rottweilers, and rough-coated collies seem to pop up as potentially having a higher risk.
Interesting. Any other factors?
Females who've never had puppies, they're called nulliparous, are also considered a risk factor. Middle-aged to older nulliparous females are sort of the classic picture.
You mentioned hormonal medications earlier. Are those a really significant risk?
Oh, absolutely. Using estrogen, like those old mismate shots,
Right, I remember those.
or using progestogen drugs to try and prevent heat cycles. Those are definite risk factors highlighted in the sources. They basically create or worsen the exact hormonal conditions needed for pyometra.
Okay. What about false pregnancy? Does that play a role?
Interestingly, the sources specifically say there's no direct correlation found between clinical pseudopregnancy, false pregnancy signs in dogs, and actually developing pyometra.
Well, that's good to know. Okay, so age, intact status, never having puppies, maybe genetics, and definitely those hormone drugs increase the risk.
That sums it up well.
So what signs might an owner actually see if their pet has pyometra? The sources say it varies a lot depending on something about the cervix.
Yeah, that's probably the most critical factor for an owner to understand because it drastically changes how the disease looks and how quickly it becomes an emergency.
Okay, tell us about that.
First, timing is a big clue. After the last heat cycle, dogs usually show signs within about 12 weeks.
12 weeks, okay.
Cats, it's usually quicker, maybe within 4 weeks of their last call. And of course, a history of receiving those hormone drugs is a major red flag.
Right. So how does the cervix being open or closed change things?
Okay, so if the cervix is open, the pus that's building up inside the uterus can actually drain out through the vagina.
Ah, so you'd see discharge.
Often, yes. That might be the only sign you see, especially early on. The sources describe it as maybe blood-stained or pus-like purulent discharge.
And the animal might not seem that sick.
Exactly. Because the pus and toxins aren't completely trapped inside, the systemic illness, like feeling really unwell, might be mild initially. You might not even feel an enlarged uterus when the vet examines them.
So an open cervix can almost be misleading, making it seem less severe than it is.
It can see that way initially, yes, but it's still very serious, make no mistake. Now, if the cervix is closed,
Okay.
this is where it usually becomes a critical, full-blown emergency.
Because the pus is trapped inside.
Yes, completely trapped. The infection, the pus, the toxins, it's all building up inside the uterus with absolutely nowhere to go.
And that makes them really sick fast.
Very sick. The toxins and bacteria are being absorbed directly into the bloodstream. That's called endotoxemia or bacteremia.
What does that look like?
You might see signs like drinking a lot more water and urinating a lot more polyuria and polydipsia.
Okay.
Extreme lethargy, loss of appetite, maybe vomiting. Their abdomen might look swollen or feel painful. They can get dehydrated quickly.
Yeah, they always have a fever?
They might or they might not. Fever isn't always present, surprisingly, but they usually look and act very unwell. And on exam, the vet can often feel a noticeably enlarged uterus, sometimes really dramatically big because it's just full of fluid.
Wow, that sounds like a much faster, scarier decline.
It typically is, yes. Closed cervix pyometra is often rapidly progressive.
So how do vets figure out definitively if it is pyometra, especially if the signs vary so much?
Well, often the diagnosis is strongly suspected, just based on the history, especially that timing after the last heat cycle
Right.
and the physical exam findings. Is there discharge? Is the animal systemically ill? Is the uterus enlarged? Definitive confirmation isn't always needed before starting emergency treatment, particularly in those really sick closed cervix cases. You have to act fast.
Sure. But what else could it be? What are they trying to rule out?
Good question. Vets have to consider other possibilities. Obviously, pregnancy could cause an enlarged uterus.
Okay.
Other things that cause increased drinking and urination, like diabetes, or Cushing's disease, or kidney disease itself. Severe vaginal infections, maybe. Or an infection right after giving birth called metritis, or even other kinds of fluid buildup in the uterus that aren't pus like mucus or blood.
So other things can look similar. What about tests? What would show up on, say, blood work?
Blood tests are very helpful, yeah. A really common finding is a high white blood cell count, sometimes extremely high.
Showing infection.
Exactly. Often with immature white cells released, called a left shift, indicating the body's really trying to fight something severe. This tends to be more pronounced with closed cervix pyometra. They might also see mild anemia.
What about blood chemistry, like organ function?
Yeah, chemistry panels can show changes too. Things like high protein levels, specifically globulins, which rise with inflammation, maybe low albumin, high cholesterol sometimes. Kidney values like BUN and creatinine can be elevated,
Because of the toxins.
often due to dehydration or the bacterial toxins directly affecting kidney function. Yeah. Liver enzymes can also be high if the animal is really sick or dehydrated, and electrolyte imbalances can definitely occur.
Okay. And urine tests. What can they tell you?
Urinalysis can be quite revealing too. The urine might be very dilute, what we call isothenuric, meaning the kidneys aren't concentrating the urine properly, often because those bacterial toxins are interfering with their ability to do so.
Oh.
You might also find bacteria in the urine, or glucose, or protein. But the sources really emphasize how you collect that urine sample is critical.
Why is it that?
If there's vaginal discharge, just catching a midstream sample is unreliable because it'll likely be contaminated.
Right.
So you really need a sample collected carefully via a catheter or directly from the bladder with a needle cystocentesis to know if bacteria are truly in the urinary tract itself.
Got it. Okay, so blood and urine tests give lots of clues about the infection and how the body's coping systemically.
They do. Other tests might include looking at the discharge under a microscope cytology, which can show inflammatory cells and bacteria.
Does that confirm Pyometra?
Not definitively, because you can see similar things with just a vaginal infection. Culturing the discharge for bacteria is useful not for diagnosis itself, but absolutely essential if you're considering medical treatment to know which antibiotic is best. But again, proper collection from high up in the vagina or ideally the uterus is key.
Okay. Any other specific tests?
Sometimes testing for Brucella canis is done, as that can cause reproductive issues. And checking progesterone levels if it's high, over 2 ngml, that strongly supports the diagnosis, confirming that hormonal influence.
Right. Back to the progesterone. What about imaging? X-rays or ultrasound?
Imaging is often really key, especially ultrasound. It's generally considered the preferred method.
Why ultrasound?
It gives a much clearer picture of the uterus than X-rays. It can actually show the fluid inside the uterine horns, measure how thick the uterine walls are.
Okay.
Sometimes you can even see signs of that underlying CEH. It's really good for differentiating pyometra from, say, pregnancy or other types of fluid.
And X-rays help at all?
They can. X-rays might show an enlarged, fluid-filled tubular structure where the uterus should be, but it's just less detailed. Ultrasound really lets you see what's going on inside much better.
Okay, so history, exam, blood and urine tests, and imaging, especially ultrasound, all piece it together.
That's the usual diagnostic process, yes.
And treatment. You said it's urgent, especially for closed cervix cases?
Absolutely. It is an emergency, particularly those closed cervix cases. They are life-threatening without prompt aggressive treatment. Most animals definitely need to be hospitalized for intensive care.
What's the very first step in treatment, usually?
Immediate supportive care, that's critical.
Yeah.
It means getting intravenous fluid started right away.
For the dehydration and shock.
Exactly. Combat dehydration, support circulation, help flush out toxins, and starting broad-spectrum antibiotics immediately, even before you have culture results back, to start fighting the bacterial infections systemically.
Okay, fluids and antibiotics up front. Then what are the main treatment paths? I assume surgery is common.
Yes, surgery and ovariohysterectomy, or OHE, which is basically a spay, is the definitive treatment and the most common approach.
So removing everything.
Removing the ovaries, the entire infected uterus, and the cervix. This gets rid of the source of the infection and the source of the progesterone driving it. It's the treatment of choice for most animals.
Which ones specifically?
Those who aren't intended for breeding, obviously. Also older animals, animals who are already very sick from it, or those thought to have significant chronic uterine changes. That CEH surgery offers a cure.
Is medical treatment ever an option, like just using drugs instead of surgery?
Medical treatment is possible, but the sources are very clear that it comes with significant risks.
Like what?
The biggest risk is uterine rupture, which can be fatal. Also, recurrence is much higher after medical treatment compared to surgery.
So who is it considered for?
It's generally reserved only for young, otherwise healthy, valuable breeding animals
Okay.
who are not severely ill, don't have signs of kidney problems, and crucially, usually have an open cervix, allowing drainage.
And even then, owners need to understand the risks?
Absolutely. Client education is vital here. They have to understand the rupture risk, the chance it might not work, and the high likelihood of recurrence in future cycles.
What else?
And if they do choose medical management and it's successful, the animal must be bred at the very next heat cycle.
Why is that?
Pregnancy seems to offer some protection against recurrence. And then they should be spayed after they've had the desired litters. If medical treatment doesn't work quickly, or if the animal gets worse, surgery becomes the necessary backup plan.
Okay, so surgery is the main route. If surgery is chosen, are there special considerations? You mentioned that big, pus-filled uterus.
Yes, definitely. Especially with the closed cervix where the uterus might be huge and very fragile.
Right.
The surgeon has to be extremely careful during removal. You absolutely do not want to spill that pus into the abdomen. That causes peritonitis, a severe abdominal infection.
How do they present that?
They use careful handling techniques, sometimes isolating the uterus with sterile, saline-soaked sponges before removal. But just as important is stabilizing the patient before surgery.
With the fluids and antibiotics you mentioned.
Yes, getting them rehydrated, starting antibiotics, correcting electrolyte imbalances, getting them as stable as possible makes the anesthesia and the procedure much safer.
Makes sense. What about the specific medications used? You mentioned antibiotics for everyone.
Right. Antibiotics are given immediately, usually IV at first. They're chosen empirically, meaning based on the most likely bacteria. E. coli is very common.
Okay.
Options might include ampicillin, amoxicillin clavulanate, or cephalosporins, like cefazolin. Then, if culture results become available, the choice might be adjusted. But you start broad spectrum right away. And they need to be continued for a decent amount of time, often at least 2 weeks, even after the animal seems better.
And what about those drugs used in medical management? Prostaglandins?
Yes, prostaglandins, specifically PGF2 alpha, are a key part of medical management.
What do they do?
They have 2 main effects. They cause the corpus luteum on the ovary to break down, which stops progesterone production.
Ah, cutting off the fuel.
Exactly.
Well,
And they also cause the uterus muscle to contract, which helps to expel the pus out through the cervix, assuming it's open or can be opened.
are there side effects?
Yes, there can be. Things like temporary panting, sometimes vomiting or diarrhea, maybe some anxiety or restlessness shortly after injection. Vets often manage this by starting with lower doses. Cats seem a bit more resistant to these side effects.
Is this an approved use for these drugs?
That's an important point. The sources note these drugs are often not officially approved for this specific use in dogs and cats in places like the U.S., so it's considered off-label use, requiring informed owner consent.
And you mentioned a risk with closed cervix cases.
A huge risk. Using high doses of prostaglandins, or certain types when the cervix is firmly closed, is very dangerous. The strong contractions against a closed exit can easily cause the uterus to rupture.
Okay, so careful patient selection is key for prostaglandins. Are there other medical options?
Yes, the sources mention other drugs, often used with prostaglandins. There's a progesterone blocker called aglapristone.
How does that help?
It directly blocks progesterone's effects on the uterus and cervix. It's particularly good for helping to open a closed cervix, often with fewer intense contractions initially than prostaglandins alone. So it might be started first, then prostaglandins added a day or 2 later once the cervix is opening.
Is it available everywhere?
Not everywhere, no.
Yeah.
The sources note it's not registered in the U.S., for example. And it shouldn't be used if the animal has significant liver or kidney issues.
Any others?
There are also dopamine agonists, like cabergoline or bromocriptine. They also help lower progesterone indirectly and can help relax and open the cervix. They're often used in combination with prostaglandins, too, usually given with food to reduce potential vomiting.
So medical management is often a combination of drugs.
Frequently, yes, aiming to lower progesterone, open the cervix, and stimulate expulsion of the pus while managing side effects and risks.
I think I even saw a mention of some kind of flushing technique in the sources.
Yes, that's mentioned too, a transcervical flushing or lavage technique.
What does that involve?
It involves carefully guiding a catheter through the cervix into the uterus. Then the uterus is flushed, usually with sterile saline, sometimes with prostaglandins added to the flush solution to help physically wash out the pus.
Does it work?
It's reported to potentially resolve the infection more quickly, maybe within 3 to 5 days in some cases. But again, it requires specific expertise and equipment, and the risk of uterine rupture during the procedure still exists, so patient selection is important.
Okay, so summing up treatment. Surgery is the standard curative path for most. Medical management is a riskier alternative, really only for specific, stable breeding animals, often involving a cocktail of drugs like prostaglandins, maybe progesterone blockers or dopamine agonists to help empty the uterus.
That's a good summary, yes.
What happens after treatment? And crucially, how can we prevent this in the first place?
Okay, follow-up is essential, especially after medical management. You continue antibiotics well after signs resolve.
How do you know it's resolved?
You monitor the animal closely, their attitude, appetite, watch the vaginal discharge change from pus back to maybe normal mucus, and then stop. Ultrasound is key here.
To check the uterus.
Yeah, you do follow-up ultrasounds to confirm the fluid is gone and the uterus is shrinking back down. Ideally, you see significant reduction within a few days and near complete resolution within about a week or so. Blood work is usually rechecked too to make sure those white cell counts and inflammation markers are normalizing.
What about long-term for breeding animals?
For those treated medically, another ultrasound maybe 4 weeks later is recommended to assess the uterine lining, the endometrium, for any persistent CEH, as that impacts future fertility. And if there was suspicion of a related kidney infection, urine cultures are needed after treatment.
Okay. Now, prevention. This sounds like something owners would really want to avoid. What's the best defense?
The absolute best, most effective way to prevent pyometra is elective spaying, the ovariohysterectomy we talked about.
Just spaying animals not meant for breeding.
Exactly. In any female dog or cat, not intended for breeding, since progesterone from the ovaries is the essential trigger.
Removing the ovaries removes the risk.
Precisely. It eliminates the possibility of pyometra developing later in life.
What about for responsible breeders? What can they do?
For breeding females, the recommendation is generally to spay them once they've had the desired number of litters. Don't keep them intact indefinitely, just cycling.
Does age at breeding matter?
The sources suggest breeding females younger, ideally maybe under 4 years old. The thinking is that a uterus that experiences pregnancy is less susceptible than one that just keeps getting exposed to that prolonged post-heat progesterone phase, cycle after cycle, without becoming pregnant.
Interesting. And if a breeding animal was treated medically for pyometra, you said breed them next heat.
Yes, that's the strong advice. Breed them immediately at the very next heat cycle after successful medical treatment. Again, pregnancy seems protective.
Anything else for breeders?
Just generally, good breeding management practices are stressed. Using high-quality semen, ensuring proper timing for breeding to maximize conception chances, maybe monitoring vaginal cytology during heat, and using antibiotics proactively if they see signs of inflammation, like lots of neutrophils.
Okay.
There's even mention of potentially using a drug called mibolerone sometimes, if medical treatment causes the heat cycles to become too frequent, just to lengthen the interval between heats and give the uterus more time to recover before the next progesterone exposure.
Right. What about potential complications? Can things still go wrong even after treatment starts?
Well, pyometry itself is serious, but complications can certainly arise. With medical treatment, as we said, recurrence in a future cycle is a significant risk.
Okay.
Sometimes they can come into heat quite early after medical treatment, too.
Mm.
And in severe cases, especially closed cervix, where toxins have spread systemically.
Yes.
Potential complications mentioned include kidney failure, either acute or developing into chronic kidney failure, widespread bloodstream infection, septicemia, leading to shock, infection potentially spreading to other organs, what they call metastatic infection, and if certain types of bacteria are involved, they can even predispose the animal to forming specific kinds of kidney or bladder stones, like struvite stones.
So it can have lasting consequences even if they survive the initial infection.
It definitely can, particularly regarding kidney health.
Finally, what's the general outlook? The prognosis. Is it usually treatable?
The good news is yes, with prompt diagnosis and appropriate treatment, whether surgery or carefully selected medical management, the survival rate is generally quite good.
What kind of numbers?
As long as uterine rupture doesn't happen, the sources report mortality rates somewhere around 4% in dogs and maybe 8% in cats. So most animals do survive if treated properly and quickly.
That's reassuring. What about fertility after medical treatment?
For breeding animals treated medically, the ability to get pregnant afterwards is variable. Success rates are often cited between 50% and maybe up to 90%, depending on the study and the specifics. The risk of recurrence, though, definitely depends on factors like the animal's age, whether they'd had litters before, and how much underlying uterine damage, or CEH, was already present.
Wow. That truly has been a deep dive into a really serious condition.
It covers a lot, doesn't it?
Yeah, starting with understanding that progesterone is the crucial hormone, kind of creating the perfect storm.
Setting the stage, yeah.
How bacteria then take hold, often when the cervix is open during heat. And then seeing how dramatically the signs change based on whether that cervix stays open or closes.
From subtle discharge to a life-threatening emergency.
Exactly. And finally, understanding the treatment options where surgery is really the definitive fix for most, while medical treatment is this calculated risk, mainly for valuable breeding animals, it really brings home the importance of owner awareness and getting veterinary help fast.
It really underscores how seemingly normal hormonal cycles can, under certain circumstances, lead to something quite dangerous if the animal isn't spayed.
So maybe let's leave you, the listener, with this thought to consider. Given that Pyometra is so directly linked to being intact and the normal hormone cycle, and knowing the risks and uncertainties and recurrence rates of medical treatment versus the very high success rate and preventative nature of surgical spaying, how do we, as pet owners, as people responsible for their health, how do we weigh that desire maybe to preserve breeding potential against the immediate and potentially future health risks of such a serious condition like Pyometra? If faced with this diagnosis, what level of risk would you feel comfortable taking for your pet?
It's a tough decision with really significant implications either way.
It really is. Well, thank you for joining us for this deep dive into Pyometra. We hope this has helped you understand the crucial aspects of this condition.